All right, our next speaker is Jeffrey Segal. He's the recipient of the 2007 National Strength and Conditioning Association of Personal Trainer of the Year Award. Jeffrey has written articles for numerous MS publications, in addition to others such as Shape Magazine. He's the owner of Balance Personal Training since 2004. He's also known as a national motivational and educational speaker, though that did not sound too educational. So let's welcome Jeffrey Segal.
Imagine if you're, first off, how many of you guys have ever gone skydiving?
No, but I'd like to.
Okay, well imagine this, since you haven't been. Imagine you're 10,000 feet up, you jump out of the plane, and you realize right off the bat that there's no parachute in your backpack. Now just imagine all the stuff you'd be thinking about on your way down. Would you be thinking about bad things that happened to you? I really want you to think about it. I mean, think, what do you think would cross your mind? I don't think that a bad relationship you had 20 years ago would cross your mind. I think that you'd think about the things that you maybe have let pass you by and not done. Regrets. Regrets come as things we haven't done or things we passed on. We regret the things we didn't do. The things we did, we did. We did them for a reason. Think about all the great and bad things that happened to you last year. This year is a new year. This is I've been looking forward to this year for a long time, and I'm going to explain that later on as I speak. But there's some significance to this year, as well as last year. But last year, hopefully you learned from others' mistakes. Because smart people don't learn from their own mistakes, do they? They learn from others. And if you think to all the bad things that may have happened last year and all the good things, hopefully the good things are the things that you remember better. I had some horrible things happen last year. I had some much better than horrible things happen last year too. We're in 2020. I'm still getting used to writing 2000. I mean, how many of you have written 19? I can't even write 2019. 19, you can't even fix that on a check. If you write 19, you can't even put 20 before it. Now you're stuck. So we're in 2020. So all the things that happened to you last year that were good, bad, whatever, this year, you get to fix them. You know why? Even 10 years ago's problems. Because hindsight is 2020. And here we are. We are in 2020. So all the things that may have not gone your way. I mean, last year I had people do some really bad things to me, but guess what? I had a lot more people do some really good things for me, and I was able to help a lot of people out. That's what I remember about last year. And this year is going to be even better because it's off to a great start. We're not completely at war right now. Not completely. I haven't watched the news since this morning, but things change. And hopefully everybody in here is not exhausted or has not experienced utterly the most exhaustion they've ever felt in their life today. How many of you are utterly just exhausted right now? Well, guess what? A few people did raise their hand. You made it here, didn't you? Yeah. That's an accomplishment. You guys get the benefits of what we're going to be telling you and what you just learned. That was great. I mean, I learned something from what she said. I hope you guys did. How many people in here did not learn anything from that talk that listened? You couldn't have, because it was a great presentation with great information. And take that home with you and learn from that and expand on that and teach somebody else that. Because one thing that's great in life is you have the ability to learn, and if you do learn something, it's almost your duty to teach it to somebody else. And if that keeps going and going and going, we're all educated, right? We're educated by learning from others. And the problem is there's ignorance out there, and there's a lot of it. And a lot of people are okay with that. I'm not. I want to know more. And if I don't know something, I want to know it twice as bad. So I've learned some stuff from people in here. In fact, I talked to some individuals before the program even started, and I was fascinated by some of the responses I got from some simple questions. But one in particular was, I want to know what they were going to do this year, what their plans were, you know, if they wanted to know anything about health, wellness, exercise, what they can do to better themselves. And they said they were taking some time off of work for themselves, to focus on them. How many of you guys focus on yourselves and think about that? And focus, I want to do better, I want to be better, and not just think about it, but actually do it. You have to put these things into action for them to work. I'm going to show you some really cool stuff. That's a given. But it's up to you guys to apply it to your lives. Because if you don't apply it, it's only going to do me well, or the people that do apply it. And I'm sure you've heard the similar stuff from your physicians. You need to get out and do more. You need to exercise. You need to have a better diet. How many people in here don't know what a good diet is? So there's nobody in here raising their hand, so you know what a good diet is. How many people in here know what a bad diet is?
No.
A good diet is basically just not eating the bad stuff. The rest is good. And then, make it colorful, and like your plate. You had a few different colors on your plate, and none of it was candy, so it counts. How many people in here had New Year's resolutions? I'm glad not a lot of people raised their hands, because usually every year you get the same thing as your resolution. And resolutions are more than writing something down, hoping it happens. They become just wishes. Application gets things done. When you apply what you've learned and you apply what you want to change, change occurs. But when you just talk about it, it's lip service. I'm going to move this out of the way. I'm going to put it over here so we don't hear that loud noise again. I didn't hear it though. Do you guys hear that? Okay. How many people in here live life to the fullest? How many people in here feel you're the best you could possibly be? I see like 1 or 2 hands being raised. You guys are missing out, and it's your fault. You can't blame it on anything, because to be the best that you can possibly be doesn't mean you have to be better than you were 20 years ago. It means the best right now. So if you're not taking advantage of the things that you can do right now, don't complain to me, don't complain to the person next to you. I don't want to hear it, they don't want to hear it, it's bullshit. If you ask me, it's garbage. Do what you know you should be doing. Don't talk about it. It's I can't stand hearing that. In fact, 20 years from now, you're going to look back at what you did or what you thought you should have done. How many people in here are grandparents? I know you've got a lot of stories. All right? Do you tell your grandchildren horrible stories of the bad stuff? Or do you tell them fun, good stories that they're going to remember? And then you can tell them it 10 times. And they'll be like, Grandma and Grandpa told me that 10 times again. Well, that's what life is all about. Creating experiences that you can tell others, passing it on, and then that becomes what? That's your legacy. You want to have a legacy that's great, that people will remember? I do. I'm on YouTube. I can't get past some of the lies I've told. People come up to me and ask me, did that really happen? I'm like, what are you talking about? They're like, we saw it on YouTube. I'm like, YouTube lies too. I don't know how they made me a ventriloquist, but I can't do that all the time, right? How many people in here have a question? I'm not going to answer it right now, but have questions and concerns about exercise and diet and that type of stuff. Do you guys know it all? I know everybody in here works out, exercises every day, knows the right kind of exercise. There's wrong exercises. There's exercises that will not help increase your function. And then there's exercises that will help increase your function and make you look better. And guess what? Those come with a smile too. Show your white teeth. And if you don't have white teeth, show your yellow teeth. And if you have brown teeth, keep your mouth closed. Or if you have no teeth, But I learned by making mistakes. I work with other people, and what I do when I get to somebody's home, I go into people's homes. You know why I go into their homes? Because when I get there, there's no escaping. There's no calling and canceling. They can either listen to me for an hour, they can exercise for an hour, they can exercise with me for an hour, but they're not going to kick me out. I won't leave. They're stuck with me. And the benefits that they reap from it are incredible. And I can see things that they don't see. You ever exercise with somebody else and somebody else pointed something out that you weren't doing correctly? Well, I'd much rather point out something that people are doing correctly, which is just about everything they do. And that's how we've got to start thinking about things. If you dwell on the one thing that went wrong today, you missed out on everything else. You know, someone was telling me a story the other day about, wow, you know, 50% of the people, and they said something negative, 50% of the people in here can't do this or that or the other. And I said, imagine how that statement would have been if it started out by, can you believe 50% of the people in this room could do X, Y, and Z? If you think that way, life is a lot better. You open your eyes up to everything. All the things that we wanted and we can and we might, and they happen. And they do it not thinking about the glass being half empty or half full. Guess what? While people are talking about the glass being half empty and half full, I drank it. So if it's empty, it's because I drank your half full glass. How many people in here stretch, flexibility, do that type of stuff? Well, I'm going to tell you one thing, and don't let this leave the room, except for YouTube. I don't stretch. Personally, I don't stretch. I don't stretch the way you think of stretching. When you think of stretching, you think of going and holding a static hold and, like, you know, maybe touching your toe, stretching your hamstrings, that type of stuff. If you exercise in full range of motion and you do the exercises properly, you are stretching every time you do a movement. If you do a bench press, you're stretching your chest this way, you're stretching your back this way. Same thing with a bicep curl or a tricep extension. However, if you've worked with me, I'm not one to really give out those types of exercises, curls and extensions, because there's not much function in them. I only do those if that's all you can do. But I guarantee you, if you were to write down everything that you can do on one piece of paper and everything you can't do on another piece of paper, you'd run out of room on the page that's about what you can do. But it's something that you really should try. Just start writing all the stuff you can do. And then if you write the stuff you can't do, there's not going to be that many things, but they're going to be the things that upset you the most and you think about too often. Think about the stuff you can do and do it. I'm going to pull out this table over here. And there's also lots of obvious stuff out there that we overlook. How many people in here knew that in your car, if you want to know which side of the gas tank is on, there's an arrow next to the gas button? Most people that know it didn't know it for a very long time, and someone told them it, and then they're like, whoa, really? I knew that. It's okay to tell people things like that. But what about nursery rhymes? I'm just going to tell you a couple things about nursery rhymes. I can't stand them. I'm happy my daughter's 14 years old now because I don't have to think about nursery rhymes. They are depressing. I will tell you, that little piggy that went to the market, he didn't go there to shop, or she didn't go to the shop. They went there to be slaughtered. That's the way it goes. All nursery rhymes, they're horrible. The old man bumped his head, didn't wake up in the morning. Why do we teach our kids this? What about the victory? You know, the victory one. There is no one. Because bad news sells, and unfortunately, we teach kids at a young age all these bad things about, what is it, give me an example of a nursery rhyme. Rockabye baby. What happens at the end? I don't know. Hopefully the baby's asleep, right? That's one of the better ones. But then the baby's asleep and you don't get to enjoy the child. Humpty Dumpty, broken to pieces. Not even the horseman could fix him, right? Yeah, that's the worst of them all. Ring Around the Rosie, you guys know about that one? Yeah, so you don't stink when you get buried. All right, so this is a massage table. How many massage therapists do we have in the room? How many massage therapists do we have in the room? How many people in here get massages? Me too. You start. I'll lay here. You go first. So what I like to do with this is I use this for flexibility. I also use it for strength training. I also use it for sitting down on. But I'm going to show you a few things that you can do on it. I'm not going to show you things you can't do on it. That'd be pretty bad. How many people in here can do a squat? This is a great height to show this. If you can't do a squat, you probably can, you just don't realize you can. A squat is getting up out of a chair. Okay, if you can't get up out of a chair, but you can get up out of this, that's still a squat, it's a modified squat. But if you don't do it, it's not that you can't do it, it's that you won't do it. I don't know why people choose not to, but if you write stuff in the morning down and you hold yourself to it, at the end of the day you can talk about what you've done. I cannot stand when I ask people about stuff and they say, I used to be able to, or I want to. That's BS. Wanting something is not going to get it for you. What you used to be able to do is no relevance to what you're doing right now, other than you did it before, you probably can do it now, if not at the same capacity, somewhat similar capacity. That's success. Success is being exhausted and still going a little bit further. Even if you have MS and you're exhausted, okay, there's things that you can do while you're exhausted. Sleep is one, but you know, there's other things that you can do. If you want to go to the gym and you're having a really bad time, you know, with fatigue and that type of stuff, flexibility, yoga. You can do other things that aren't motion, not jumping and running and that type of stuff. Forget that. The things you can't do, take off the table. The things you can do, they're open for you to do them, if you'll do them. I'll do them. I'll do them with you. Call me. I'll come drive up here and we'll do it together. What's that?
You live too far.
Try me. I'm here, right? I live too far, but here I am. Somehow I got here. Thanks to Stuart. We pushed the car all the way here. That was my exercise, 200-mile car push. You'd be surprised, though. I've had people in their 70s push my car. Yeah, good. Check it out. Next time it'll be completely different. No, I've had people in their 70s push my car. And it was phenomenal for them because they were able to do it and they didn't think they can do it. And if you can do something that you thought you weren't able to do, instant success. And
2 weeks ago, pushing cars is not easy. My son had to do it.
yeah, especially when you got a flat tire. But there's a lot of stuff that we know that we can do. We want someone else to do it for us. It's not going to happen. I do demonstrations all the time, and you know what it does for me? It's really difficult to gain weight. I can't put weight on unless I'm eating, you know, as much as you guys had for dinner throughout the day, all day long. But I'm on my feet all day. And when you're on your feet, that's a functional thing to be on. If you can stand and you don't stand, guess what you're doing? You're losing bone. Get your feet on the floor and stand up. How many people in here can stand up? Prove it. Seriously. Stand up. For real. This is the real world. We're going to do real stuff. Oh, well, you could have stood up. You know what? If you guys are used to sitting that long, shame on you. You guys should have stood up. You guys are dehydrated. All of you should have been to the restroom at least once already. All right, you guys can sit down. I may ask you to stand again. I may not. I may forget. I don't know. If you don't want to stand again, then just stay up. So the squat motion, like what I was saying, this is a modified squat. Chances are, if you were to do a squat with a chair behind you and you were to fall, you'd fall back into the chair because you know it's there. If you fell forward, there'd be less damage than if you fall backwards. If you fall back, hit the back of your head, you can go blind. You fall forward, you hit your face, that might be worse because it's a cosmetic problem. But your function would be better than landing on the back of your head. Here's something that I do. If this was too low and you couldn't do that, this is about the same thickness as a phone book. Do they still make them? If they don't, you can go to Goodwill. You can get an old phone book. Then you can crank call people that don't have numbers anymore. So you can sit and stand from a higher position. It's like the barber chair, right? We all sat on a phone book at some point, except for me. I don't have hair. Or maybe that seat was too high and they cut too much off. But this is a foam cushion. It's an unstable surface. I use it for the most part for people to help get out of a chair. I don't like training people on an unstable surface unless they can really stand on a stable surface, which is this. This is a stable surface. This is unstable because it's squishy. If you know, standing on one foot, this is the best thing for like ankle rehab because you're stabilizing. You see my foot going back and forth? That's my good ankle though. No, I'm just kidding. That is my bad ankle. This is or the other side. If you can stand on one foot, you know what you should do? Do it when the doctor asks you to. Because we don't live on one foot. Is there any exercises in here that people don't understand before I get on the table and start showing you stuff and getting some volunteers up here? Anything that you guys would like to do or that you do or aren't sure that they're correct? You guys know it all? No. You guys, so yeah, go ahead.
You strictly, not strictly, but are your exercises designed for people with MS or just all in general, anybody?
My exercises are designed to enhance movement
Okay.
for anybody.
Is there a recommendation of a program for people with MS? What
Here-
they should do?
That's like going to a doctor and saying, I have MS, what med should I take? There's a lot more that goes into it than that. Every single person is different. So when I work with people who have MS or don't have MS, I'm looking at the same thing. I'm looking at what their abilities are. And you take their abilities and you increase their abilities, and as you increase their abilities, their function increases and goes along with it. And that's very important because we're all different. You know, everybody in here is not on the same medicine. Okay? Everybody in here would not respond the same to the same medicine as the next person, and if they did, there would be only one medicine, right? And it'd work for everybody, for everything. And things would be cured and all that kind of great stuff. What's been cured lately? How many illnesses do you know of that's been cured in the last few years?
Clinical trials, sickle cell anemia has responded to stem cell.
But that's still in research phase. What I'm saying is illnesses that are being cured. Yes, I'd love there to be a cure for MS. I too have it. I live with it. I've been living with MS for 21 years. I had my anniversary in October. October 29th was my 21st year living with MS. What a pain in the ass, right? To have an anniversary like that. But I look back and I say, wow, you know, there's so many things that I've done because I had MS, because I thought maybe I wouldn't be able to do them, so I still did it. And I did more and more and more. And I was able to lose almost 100 pounds while I had MS. And that was a lot of muscle I had to lose because, you know, what I realized one day was, wow, I got this big chest and I could bench press 400 pounds, but grabbing the seatbelt's hard to pull over. So little things like that. And if you do want to lose weight, you know what the easiest and fastest way to lose weight is? Cut a leg off. No, it's really slow. You should lose weight very slow, because if you don't lose weight very slow, you'll gain it back very fast. That happens. That's what happens with diets. Diets with names have ends to them, usually the first or second week of them, and then you go back to eating again and eating the improper foods. Eating a healthy diet is just an overall lifestyle. Same thing with moving a lot and getting up and going and doing stuff. If you can walk around, how many people here can walk around your block once? How many people in here walk around the block once? You know, it's rare. But if you can do it, you should. You would know why? Because there may come a day that you can't, and you'll look back and wish you did. That's why it's 2020. This is the year. This is the hindsight year. Everything that you did in the past that you didn't want to do or you wanted to have happen, this is the year we're going to fix that. Okay, who wants to come up here? I'm going to show a couple of stretches that are helpful for people with MS, right? You want to know the answer to that? MS stretches. What is the give me a problematic part of your body that you've had. Back. Do you relate the back problem to MS? Why? Is that the answer? Like when you go to your GP and they say it's because of MS?
Legs. It just the main pain that I have is in my lower back and it's combination of MS and my UTIs. And that's where I have most of my pain.
Okay. Anybody else?
The legs.
The legs.
Foot drop and spasticity.
Anything else?
Arms or backs.
So, but how about as far as balance? Okay, so if you get up and walk more, you're working on balance. If you have improper technique to walking, that's when it's time to go see a physical therapist. And it's important. Physical therapy, occupational therapy, they're fixing something. What I do is I'm enhancing something. I'm taking what you have and I'm making you better at whatever it is that you have and can do. And you know what? I am so sick and tired of people getting pissed off when someone tells them that they look good. You know what? You guys all look like shit.
How insulting.
Yeah, that's insulting, right? Because you know what? If I told somebody, there's got to be a person in the room that if I told them they look good, they'd say, but I don't feel good. Okay, well then you look like hell and you feel like hell too. There, you feel better now? No, take a compliment. You know what? If you do stuff for yourself, you will smile and it will make a difference in someone's life. Chances are it's your life. But even better yet, it could be the person next to you or someone else who thought, oh wow, they lost hope. No, you didn't lose hope. You just lost the, the ability to smile when you should smile. Smile when you're happy. People around you will be happy too. I want a volunteer to come up here. Anybody, I don't care. As long as it's not him. There's no one over there. Come on. All right, you want to come up here? Come on, yeah, get up here. Just don't curse, only I can. I slipped up. I'm going to get fined. But you are going to be on video, so if you come up here, I just want you to come on. Yeah, but is it okay for you to be recorded? Just sure. You have to look over there.
Hi.
Okay, have a seat.
Okay.
Now stand up. So you did at least one squat today. Actually, two, because I saw you get out of your chair.
Yes.
Okay, so what kind of stretching do you do? What kind of tightness do you have? What kind of issues do you feel you need help
I
with?
have tightness in my legs.
Where? What part of your legs? Your legs are
The
long.
outsides of my legs.
Okay.
Sometimes not every day, not every step I take, but my legs will shake.
Touch the area that you have.
Here.
It's tight there. Okay. Do you mind laying on the table?
No.
Which leg has it more? Now, here's something, a caution when it comes to stretching. I'm not going to really push her into a deep stretch because she has been sitting here for a long time. Her muscles are tight, which is a cue for you guys. If you're going to stretch and do static stretching, it's best to loosen up first because your muscles need to be warmed up, or else they're going to be even tighter and you could snap them and tear them. And this is supposed to help, not hurt. Okay, so does this leg have spasticity on the outside?
Yes.
Okay, so what I want you to do is, okay, just relax. I'm holding your leg. If I let go, it should drop.
Okay.
I'm not going to let go. Okay, so is that where you feel the pain? Do you feel the stretch?
No, I feel a stretch right up. Back.
Okay, so what about here?
Whoa!
Is that where you have pain?
No, that was in my knee.
Okay, on the outside or the inside?
On the inside. Wow.
Is that getting to the side?
That felt good.
That felt good?
I felt something,
Do you feel that along here?
No, I feel it in my butt.
Okay. Okay, so if you want to try something like that without somebody helping,
That knee doesn't bend so well.
relax completely. Let it drop.
Okay.
Let it drop.
It's dropped. No,
Can
I
you
have
bend it at
RSD
all?
in this knee.
You do? Is that CRPS?
Yeah.
Okay. We'll call it RSD right now.
Okay.
All right, so where do you have pain in this leg from the RSD? RSD is not related to the MS, right?
No.
The knee?
No.
Okay, so I'm not going to mess with this one because if I put the wind on that, it would probably hurt, right?
Yeah.
Okay, what about your hip flexors? Are they tight?
No, they're really good.
Okay, so what can I do to this leg that I can't do to that leg? Tell me an area in this leg that's...
In bed in the morning, I usually do.
Oh, so you
These
do,
before I
okay,
go
that's
to
good.
bed, both sides.
Yeah.
And sometimes I'll hear a pop and sometimes not. And I'll want to hear the pop to stretch it to that point.
The pop, as long as it doesn't hurt, it's good.
Yeah.
You know, people always ask me, why is my shoulder cracking? What does that mean? You know what the answer is? Good hearing. Unless it hurts. If it doesn't hurt, don't worry about it. You know, I can tell you every joint in my body makes some kind of a noise. All right, so what about, do you have back issues? Or?
I have back issues.
Okay, so a stretch for your back
Yeah.
is, you can do it yourself by pulling your knee to your chest. I got it, don't worry. Can you feel your back stretching right now?
Yeah.
Okay, so what else this is doing is this is stretching your other hip flexor on this leg.
Right.
So if I don't want to push too hard, but you feel it up in the top by me doing that? So what I was going to show her, but because of that leg being problematic, she's got something else going on that's very painful.
Yeah.
If you were to lay on a table or on a bed or something and let that leg hang off the table, or leg, I'm going to have somebody else come up so I can show because I don't want to mess with that side, but I'm going to help you out. But thank you so much for coming up.
Okay. Good. My core's not bad.
Not at all. All right, somebody else come up here. You in the middle again. All right, I'm going to pick somebody to come up here. Somebody that's wearing a black shirt, come up. Stuart Schlossman, please come up here. All right, come on up here. Come up here. What? Never mind, Stuart. You're.
She's not wearing a black shirt.
No, she's not.
You didn't move, so.
Yeah. You move pretty quick. Are you okay doing this? Do you give consent to be on video?
Oh, I'm sorry. Yes, I consent to be on the video. Hi, everybody.
Okay, so tell me a little bit about yourself. Do you have any tightness, spasticity?
Well, okay. I moved into an apartment on the 4th floor.
I want to know if you have spasticity or tightness. I don't want to know about your apartment.
Yeah, well,
No, I'm just kidding.
well, that's what's been helping
What has?
with my leg, my knee,
What's been helping?
walking down them.
Down the steps?
Yes.
Oh, walking down is usually a little bit more difficult than walking up, but that's good. So you have tightness in your knee?
Yeah, it's this one. But you know.
Okay, well, lay on your back. Do you mind laying on your back? I'm going to show you an exercise that's a stretch and it is a range of motion and flexibility. I'm not helping you. You got this. Okay, keep both your knees bent at 90 degrees. Okay, have you ever done a bridge?
No, like this.
Of course you've done a bridge. Well, she said no like this. She's an expert.
Well, there are some people that really get into the.
I'm not talking about like getting on your hands and doing a backflip. Okay, so right now what you're doing is you're lifting up, you're working your glutes, but higher, a little bit higher. Okay, now go back down. So what you just did was, by coming all the way up, you stretched your hip flexors. Your hip flexors and your abs are getting put on stretch. Hip flexors are very problematic for people with MS because it's hard to lift. They get tight, they get short, they get weak. And like I was saying before, if you were to hang your leg off to the side of the table, your hip flexor would stretch. You got to scoot over a little bit. I gotcha. Okay, so let this hang off. This leg straight. Can you feel your hip flexor? A lot?
Yep.
Too much?
No.
Okay. So, now don't let it swing. Yeah, this is your hip flexor right here. So if somebody was with you and you wanted help, or if you wanted to put something around your leg,
Up.
that was enough? Was that too much of a stretch? Were you afraid I was going to break your leg off?
Yeah, because that's the knee I did break. So.
Okay, well when you do the bridge like you did, what you're also doing is you're building some of your quads, and sometimes that loosens up a little bit of the pain above the knee because your whole quad is stretching when you're coming up. So that might be the perfect exercise for you. It may not, but you won't know unless you do it. So you ought to give it a shot because you're able to do it and you did very good form up here. And she deserves a round of applause for doing that. But that's a very good exercise for you. It's multifunctional too. All right, you can sit up now.
You sure?
No, I'm not. I think you can. Let's see. Okay. Are you dizzy?
Just a little bit.
Okay. So you're a little bit like most people then.
Yeah, you know when they put you on that table for an MRI or whatever. And you
I don't know.
I just tell them.
That's the best sleep I get all years when I get an MRI.
And I tell them, don't hurry. I will do it myself. Oh, yeah. I make sure I.
You know that pounding sound? Bum, 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 bum. I can never reach 1,000. I count and count and count. By the time I get to like 264, 265, I'm out like a light. Thank you very much for coming up here. All right, anybody else want to come up here? Okay, who doesn't want to come up here? Raise your hand. So there's people that just aren't sure right now. Come on. All right, I'm going to do one of these.
Did you bring up a person yet that does not have MS?
I don't know. They didn't tell me. Who in here does not have MS? Raise your hand. Okay, you. Come on up here. Yeah, you in the white. You in the white. Come on.
You got a torn meniscus.
You got a torn meniscus.
You got a bad back. I am not going up.
Are you going home?
Yeah.
How you getting there?
Driving.
You got to get to your car somehow. I had a torn meniscus. I had it fixed 2 years ago. It sucks, right?
Oh man, that's terrible.
But the exercise that I showed her, the bridge, that's very helpful for a torn meniscus.
Really?
Yep.
I'll try that at home.
All right. Come on, somebody who doesn't have MS. I'm going to close my eyes and I'm going to see someone walking up here who's...
Just so you know, it's nothing physical.
It's nothing physical, and I'll tell you one thing. If you have MS, if you do not have MS and you are here, You are a lot less uncomfortable than the people who have MS that are here. You coming up? All right. High five. Have a seat. Okay. I want you to lift your left knee up. Now your right knee. Okay, he doesn't have MS. He's right. Okay. Okay, lay on your back. Okay, any pain right now? Any tight muscles, anything?
Just my back a little bit. I do have back pain.
Okay. Anybody in here, since he doesn't have MS, I'll do whatever. You tell me what to do. I'll twist his leg off if you want. No, someone give me an example of some tightness somewhere that you have that you would like me to demonstrate on him. Then I'm going to have him do a little trick over here. But
Leg cramps in your calves.
okay. First thing is you got to identify, is that something that MS is causing, or is that something that you're causing? She said she's got cramping in her calf. There's lots of things that can cause that. The very first thing that comes to mind is dehydration. If you're dehydrated, that can happen. If it happens while you're sleeping, there's many other things that could be causing it. Electrolyte imbalance, or your sheets could be tucked in too tight. Who tucks in your sheets too tight? Don't. If you have anything that causes spasticity and your sheets are tucked in tight, you're in trouble. Don't do it. So I'm going to show you what to do for, if you get a cramp in your calf, also the thing that you do not want to do is bend your leg. You want to straighten your leg, lift it up like this, as high as you can, and try to pull your toe back. Or if you were to get up, but people, if you're in bed, you're not going to want to get up, but you can wrap something around it, pull. I've told people to hold a towel in their bed so they can pull their foot back with. Can you feel the stretch in your calf?
Yes.
Does it feel better now?
Yes, it feels much better.
Oh, great. See? I told you he didn't have MS. Okay, so now what I want you to do is drop your leg off here, sit up, stand up, come up here. Okay, so stand right here. Okay, what I want you to stand with your feet touching each other. Okay, so this is as little stability as you're going to have standing on 2 feet without one being like this and the other one being like that. Do you feel a little bit off balance?
Not yet.
Not yet? Okay. Do you guys know what proprioception is? Proprioception? That's your ability to know where you are in space. Okay, so that requires all your senses. With MS, some of your senses are, not getting the best out of what they can get. So what I'm going to do is tell you to close your eyes.
Oh, no, I couldn't do that.
Do you see him swaying a little bit? Do you feel like you are? Okay, now you can open your eyes. Look how nice everyone looks now.
Where am I?
Stand on one leg. Now close your eyes.
It really has no MS. No.
Okay, so you guys are stereotyping, because just because he's standing on 1 foot doesn't mean he doesn't have MS, because there's a lot of people who do have MS that can balance perfectly fine on 1 foot, right? Maybe not the other foot though. So I'm going to show you some things that you can do. Do you guys have strong cores? Your core?
I can do it relatively.
Huh?
I said I can do a plank.
You can do a plank. Okay, that's good. That's anterior core strength. But you want the back side to get strong too, which is where bridges come into play. So what I want you to do is put your hand like this. Okay, now push against my hand. Push. Can you feel your core?
Yep.
I'm going to come to the other side and do this one. Push. All right, now you won't walk in circles. But that's something that you can do on your own just by leaning up against the door, pushing on the door, and that works one side. So if you push with this side's your obliques are working on this side, your external obliques and your internal obliques on this side are working, and that's part of your core. Your core is everything around here. So the people I work with, I make sure one thing, if they don't have, I didn't do my job, is a strong butt. Biggest muscle you got, least used. Seriously, you're sitting on it all day, you're not doing stuff with it, your butt should be stronger than your hamstrings. Your glutes and hamstrings are not equal. You want your strongest muscle to be your strongest muscle. You can go back there. Thank you very much. All right, so I'm going to show you a couple things since you guys are not coming up here and volunteering. And then when you leave, you're going to say, oh gosh, I really wish I did that.
She's volunteering again.
No, I'm asking.
All right, go ahead.
Gluteus minimus.
What?
Gluteus minimus.
What about it?
Hurts.
It hurts?
Yeah.
So the same thing that would stretch the maximus would stretch the minimus.
What she said, her butt hurts.
More.
That's
Okay.
Yes,
this side. Or
turn it down.
that way. That way. Or the same thing when you're coming all the way across. So that's getting right up in here. The hip flexor is going to be this. So anything that lengthens the muscle, but if you were to bend it, I mean, you could play guitar in my hip flexor right now.
I do that on the edge of the bed.
Same thing as this, yeah.
Yeah, and then I just flip and do the other side hanging off the bed.
That's good. Anybody else have any questions about stretches? Range of motion. If you can, whatever motion your body goes in, unless you're hyperextending your elbow and you hear that pop and it hurts, you should be doing that. That's exercise. If you're sitting down, I'm going to show you. You guys, if you've seen me do stuff on YouTube on MSB's News Learning channel, that's the queue. That's where you guys need to go to find all these talks. I always carry one of these with me. Today I happen to have like 10 because I kept forgetting. Did I bring it? I grabbed another one. Did I bring it? So now I got 10 with me. Doing stuff like this, believe it or not, does this look difficult? Do you know what this is doing? It's doing 100% more than this.
That's true.
That's movement.
What is that?
There's a furniture slider.
Furniture?
Yeah, you can get it at Home Depot. You can get it at Walmart. You can get it on Amazon. You can get it from your neighbor. Get it from the furniture mover people. I don't know. But doing stuff like this keeps you active. Doing little things. You know that people that do stuff like this, any of you have a jumpy leg? Do you realize you're burning calories? There's no battery. It's going. That's your muscles.
Some people do that. It drives us crazy.
But these are little things that you can do. I'm not telling you to make your legs jump up and down. I'm just was making a point. Movement is movement. If you can do it and you don't, shame on you because you won't be able to someday. If you wonder why you're not able to walk as fast, but you do have the ability to walk, try walking a little bit more. If you're able to walk and you choose the easy way, you're choosing the fast way to what we call disability. You don't want to give up on the things that you're able to do because it's easier to do other stuff. A little bit of hard work goes a very long way. And if you think that you're going to succeed by doing nothing and just by reading, yeah, you're going to gain knowledge, but you're going to lose the ability to use that knowledge. So you want to learn by doing, and you want to be an example. And all you people who said you were grandparents, you want your grandchildren to look up at you and say, wow, my grandparents have this, that, and the other wrong with them, but I'd never know it because they do so much.
They are good partners for exercise.
They are, especially when you lift them up and throw them around. You don't have to throw them around. You only throw them if someone else is catching that can catch. What's your question?
I go to the gym.
You go to the gym. I'm just repeating what you're saying so everybody can hear.
But my question is, I keep hearing others like, one day you should do upper body, another day why?
She's asking one day you should do upper body, other day you should do lower body. Okay, I'll give you the rundown on that. Simply put, you don't want to do the same workout with the same muscles 2 consecutive days that are building because just like sleep, the day after you work out, you're recovering from whatever you did. It doesn't mean that you can't use those muscles, but maybe not in a higher intensity workout. What I like to do with people is I like to focus on one area of movement per workout, depending on how many times they do it a week. Let's just say, for example, let's say you have 3 days a week that you're going to work out. I would do something like I would focus on pushing exercises one day, pulling exercises another day, and leg exercises the other day. That's my focus. But I will do all of the above on every day. So the traditional thing to do is, let's say for chest, what's the traditional exercise for chest? Bench. Someone said bench press. So that day I would have someone do bench press with their back supported, which is not as functional because you're not standing. So that day they're doing bench press, followed by maybe standing on one leg in between sets. If you can, stand on 2 feet. Or doing a squat on one leg if you can do a squat. So something with your leg that's not really building a lot of muscle, but it's maintaining muscle, followed by whatever the other thing was, say a pull, maybe a pull with a band, and then go back to the bench press. Now your chest muscles have got a chance to rest, and the other muscles were getting use, rather than saying, okay, I just did that set of bench press, now I'm going to sit down for 2 minutes. What's that going to do? You can sit down the rest of the day.
What do you think about the 30-minute circuits?
30-minute circuit.
Where they
Wait, let me finish hers.
You said something that I used to do. I do 3 days of machines and 2 days of the pool. But you said that I can do all the exercise of upper body and lower body in that day. And
I am not saying everybody can.
No,
But for the most part, yes. Okay, so let's say it doesn't have to be the way I just said it. Let's say you're doing legs day, and today's the day you do squats. Let's say you're doing squats, leg extension, lunges, all this stuff. After your squats, if you can do push-ups, go ahead and do push-ups while your legs are resting. If you can do pull-ups, do pull-ups. That's a pulling exercise. Go back to squats. And as you're doing this, you're shunting your blood. So your blood's going from your lower body to your upper body, from your upper body back to your lower body, and that becomes cardiovascular. So now you're doing resistance exercise, you're building muscle, you're also maintaining function, and you're getting a cardiovascular workout. That's a lot of bang for the buck, right?
Whoever's got questions, please raise your hand. Let me get to you with the microphone. 1 second, this way.
He's not going to hurt you with it either.
Okay, so, but like the bike or the treadmill, you can do every day, right? Because it's
Yes,
not like
but remember,
power stuff.
Remember, and this is a really important take-home message. If you're going to start doing something, don't start where you left off 10 years ago. So if you're going to be somebody that's getting back into the gym, and that question is why I'm answering the question this way, is if you haven't rode a bike at a gym for a very long time or anywhere and you ride it, the next day might not be a good day to ride the bike. You may want to do something else, like stretch or get in the pool or do yoga or do something else. And as you get more and more conditioned, then you can get into doing it every day. And there's going to be off days, and those days you take off. Or you do something light, rhythmic movements, stuff that's not strenuous and stuff that's not going to cause a problem. But the more sore you get, the more movement you do will help. Right.
Yes, but I have to run, so I'm not.
Come on, Stuart, you can do this. What do you think about using a rebounder in a modest way?
It depends why you're using a rebounder.
To move.
You mean like a trampoline rebounder?
No,
like the
that
small
active.
ones?
The small ones.
Look, there's so many
Stepping up,
pieces.
stepping
There's so many
down.
pieces of equipment. For step ups, I would not use a rebounder for someone who has instability.
Okay. It has
Because
a handle.
It has a handle, but is that gonna help you do something else?
I don't know.
It might be a little bit easier in your knees or something because it has a give, and that's a good reason to do it. I think rebounders are great. I like throwing stuff at them and having them come back to me, and that sort of stuff. No, I'm serious. I'll line it up on its side.
Okay.
I'll throw a medicine ball. It comes back at me. Now I'm working my core.
Okay.
So that's
That's a good idea. Thank you. This lady had a question.
Getting there next. Getting there next.
I was wondering about the 30-minute circuits like Planet Fitness has or Curves used to
those
have.
are
Is
all
that good to
designed.
do every day? Or?
Those are all there's the good, the bad, and the ugly.
Okay.
Those are designed to do exactly what I said. You'll see it'll go push, pull, and usually leg. Push, pull, leg. So that way you're getting rest in one, and then the other, and the other.
So
and
is
then
it
you
good
get
to
back.
do every day, or
Huh?
or like
It
3
is,
times?
but I wouldn't do it at higher than 50% of the maximum that you can do, because then you're getting into overtraining. But you know what? this group of people, I don't think overtrains.
Yeah, really.
You know, some of it's very, very, very rare that I hear someone tell me that they overdid it at the gym. What I usually hear is I'm afraid of overdoing it at the gym, and I don't go to the gym because of that. You will never overdo it at the gym if you don't go to the gym.
Yeah, I agree with that statement. I'm afraid to go to the gym right now. I had surgery on my right Achilles tendon. After that surgery, I was 6 months, I couldn't walk. So I lost.
Shouldn't walk after that.
No, but I mean, usually it was 13 weeks after my first surgery on my left ankle. After my right one, it was 6 months before I could actually put any kind of pressure on it. Within those 6 months, I lost everything, core muscles, because the doctor's
Because
like,
that stopped you from doing everything else.
right, exactly.
But you didn't have to stop doing everything else. You chose to.
My doctor told me not to do
Well,
anything
your
else.
doctor, which doctor?
My foot doctor,
He
surgeon.
told your foot doctor said that your left foot is bad. Don't use your right arm.
No, I mean,
Think outside the box. I'm serious,
Okay.
because that doctor's
that's in
concerned.
the past now.
Yeah,
I
but-
can't do anything about that.
Yeah, you can't.
But what can I do to, gain back the strength in the core? That's what hurts my back, and that's why I'm on the walker, because...
Can you stand?
Yes.
You don't have to right now, but if you can
Yes.
stand, that's working your core. Now, I'm going to show you something. Let's see. This is a kettlebell. It's a 15-pound kettlebell.
50?
What? 1.5. Right now, what I'm doing just by holding this is I'm working my core,
Okay.
because this is pulling me this way, and this part of my body, this part of my core is pulling me back this way.
Okay.
So if you were to sit in a chair and just hold this at your side, you're working the other side of your core.
Okay.
There's so much that you can do that you don't even realize that you have the ability to do, and it doesn't take a lot to do it. But when you're thinking about all the things that are extreme that you can't do, that's garbage. That's wasted thoughts. Do the stuff you can do. Even holding something like this. And it doesn't have to be this. It could be anything. Anything more than a pound. You do something like that. Or do something like this. Sitting in a chair. That's working your core. I have some people do it with this. So if you see somebody walking around like this, you ever see someone that's like kind of twisted a little bit like that? Which side's stronger?
The one where the shoulder is down.
This is the strong side, yes.
Yeah.
Because this is shorter and tighter. So you're getting tighter here. So what's the fix? It's not really the fix, but I would put something in their side, in their hand that's down here. So now this side has to even it out and let them walk around with it a little while. That's working core. Something else that's working core is I'm leaning forward. What's stopping me from doing this and falling this way is my core. Anything that's facing this way is working.
Okay.
Same thing if I was doing this. Right now my lower back's working, my hamstrings are working. And that can get to as extreme as doing it on the ground, which is not easy. I mean, it's something that you'd have to practice, and then or doing it on one leg. There's always a progression to things that makes it a little bit more difficult and helps you a little bit more. You never get to an exercise and perfect it, because there's always a tweak that you can do to make it more difficult and more helpful. Is there any other questions?
Let's thank Jeffrey Segal for being here tonight.
Thank you.
Thank you, Jeff.
You're welcome.